Hello, my name is Chelsea Smith, and this is my head-to-toe assessment video for NSG 451. This is my patient here. So first off, before I came in the room, I would check my orders, gather up all my supplies. I would wash my hands, introduce myself to my patient, hello, my name is Chelsea, I'm going to be your nurse today. Explain what I'm about to do. So I would tell him I'm going to do a head-to-toe assessment. It will take about 10 to 15 minutes, just so he knows what to expect. And then I would raise the bed up to my comfort level. So first, just walking into the room, there are a couple things I could do without saying anything, which would just be noting his appearance. So he appears to be well groomed. His behavior is appropriate to the situation, we'll say, so far. Then I could ask some orientation questions. So, sir, can you please tell me your first and last name?
Alex Eilers.
And where are we right now?
St. Vincent Hospital.
Okay, can you tell me the month?
August.
And the president?
Biden.
Perfect. Okay, so we know that he is alert and oriented ×4. Next, we would look at, probably take his vitals next. So we'll do temperature. We're going to say that was 98.7. We'll take blood pressure. We're going to say that was 124/86. Heart rate, we'll say that was 88. And oxygen, we're going to say he was at 99% and respirations of 18. So we've got vitals out of the way. Then I would ask, sir, are you having any pain? If you could rate your pain on a scale of 0 to 10.
0.
Okay, perfect. So that's good. We know he's not in any pain. If he was, I would ask different questions. Where is the pain? What type of pain is it? Is it stabbing, aching, dull? Is it radiating to any other parts of the body? But he's not in any pain, so we're in good shape there. So next I would look at his skin, noting the color, feeling the temperature of the skin, noting if he's diaphoretic, if there's any lesions or bruising or anything abnormal to the skin like that. We would also look for any wounds, or if he had an IV here, looking to see if that IV site was clean, dry, intact, check for patency. If he had a drain, we would want to inspect that as well, make sure we are not seeing any signs of infection, any redness, warmth, swelling, any odor coming from any drain site or anything like that. So next, just starting up at the top of the head, we would look at the hair. I would want to see to make sure that it's well distributed, not dry or too oily, no vermin, lesions on the scalp. It looks good. Moving on down a little more, we're going to look at the eyes. So I would check perla. So I would take my light, shine it in both pupils, make sure they accommodate, make sure they're both round and reacting to that light. I would also want to check just the symmetry of the eyes, and if it was necessary, we could do visual acuity as well. Going on to the ears, we're going to look for symmetry of the ears on the face. We could check hearing acuity during this time, and we could take a look in the auditory canal. Next, we could look at the face and the nose. So I would once again check symmetry. Is the nose midline? Check patency in each nostril by having him plug one side and take a breath in. Next, moving down to the mouth and the tongue, I would have him open his mouth, check the tongue, the gums, dentation, make sure there's no lesions, making sure that the mucous membranes are moist and pink. Then the neck, we're going to look for, make sure the trachea is midline. I would check the jugular vein to make sure it's not distended at all. I would palpate the thyroid gland while I'm there. Let's see. Ears, neck. Yeah, okay, so I think next, we'll move down a little more, we would do cardiac. So I would check, just looking at the chest to see, once again, This kind of goes back to skin, but making sure there's no scars or lesions or anything in that area. But I would listen for that S1, S2, make sure there's no arrhythmias. I would check apical pulse at this time. And then, let's see, lungs, we would first just note physically, is he seem to be in any respiratory distress? Is there any nasal flaring, that tripod positioning? See if expansion is symmetric when he is breathing. And then I would take a listen, probably anterior and posterior, and going from right to left in the same spot, and then moving down just to make sure that the sounds are equal on both sides. Making sure we're not hearing any crackling or wheezing, that sort of thing. And then moving down a bit more, peripheral vascular, I would check his cap refill here. I would check for clubbing by having him do this little motion here. Pulses, again, brachial, radial pulses. Neuro, so I would ask him if he's having any tingling or numbness sensations. During this time, I could do like have him close his eyes and put a cotton ball and then something a little sharper on his skin, and asking if he can feel the difference between those two, or we could do hot and cold here as well. Let's see, we covered, so then GI, first, once again, just looking at the abdomen, seeing is everything symmetrical, is the abdomen rounded, make sure it's not sunken in. Next, we would listen. We would start with that right lower quadrant and then move in a clockwise rotation. We want to make sure that we're hearing bowel sounds in all of those quadrants, but making sure they're not hypoactive or hyperactive, or just absent. We want to hear something, and then we could palpate, make sure he's not having any pain in the abdomen area, and percuss as well, just to hear what the sound is, if it's dull, yeah, in those different areas. So next, going to GU, I would ask him if he was just voiding normally. I would ask, are you having any pain, voiding, or anything abnormal as far as frequency or urgency goes? If he had a urinary device, like a Foley or a condom cap, we could note the color of the urine, possibly the smell of the urine if we were emptying that. And then lastly would be musculoskeletal. So I would look at his gait, his posture, strength. So we could test, we could do grip strength, so I could have him squeeze both of my fingers. You can go ahead and do that. Just squeeze, making sure it's equal on both sides. And then go ahead and pull against me. Perfect. And then push. Perfect. So we're just testing to make sure it's even on both sides. Another thing I forgot to mention in the skin area would be edema. We would want to check edema throughout. Moving on down to the feet, I would want to check pedal pulses as well. Yeah, and obviously this is just a very general assessment. If he were here for something specific, if he were here for a cardiac issue, I would be focusing my attention on the cardiac assessment. If it was respiratory, that would be my focus, and the other areas would just be very general. So yeah, I think that is about it. Thank you for watching.